Good morning, good afternoon, good evening, everyone. It is an honor for me to welcome you to the fourth PMNCH Policy Dialogue Series, Ready, Set, Implement, where we discuss how to accelerate action to implement the World Health Assembly 77 Resolution on Reduction of Maternal, Newborn, and Child Mortality. This dialogue will specifically focus on addressing the impacts of climate change on maternal, newborn, and child health, building climate-resilient societies. Before kicking off the dialogue, I would like to thank the Alliance for Transformative Action or Climate Change, or ATTACH, for their collaboration in the realization of this dialogue. Today's discussion builds on the renewed global commitments enshrined in the 77th World Health Assembly Resolution, which calls for accelerated progress in reducing maternal, newborn, child mortality. Colleagues, the urgency of these commitments cannot be overstated. Progress has stalled, or in some cases, reversed. But at the core of these numbers lies a critical and undeniable truth that many of us in the health community have long not paid attention to the increasing threat of climate change. The current climate mitigation commitments set us for a 2.6 to 3.1 degree warming by the end of this century. Global greenhouse gas emissions set a new record in 2023 with an increase of about 1.3 degrees compared to 2022 levels. The rapidly changing climate poses threats to communities in every country who are faced with rising temperatures, deadly weather events, changes in suitability for infectious disease transmission, wildfires, and droughts. Around the world, people are already facing record-breaking threats to their survival, health, and well-being. Of the 15 indicators used for monitoring climate change-related health hazards, exposures, and impacts by the Lancet Countdown series on health and climate change, 10 reached concerning new record highs according to the most recent data. Pregnant and lactating women, newborn, children, and adolescents are particularly affected by climate change due to their unique stages and needs in the life course. There is increasing evidence showing that extreme heat and air pollution driven by fossil fuel burning increases the risk of pregnancy-related complication, preterm births, and low birth weight, with consequences across the life course. Extreme weather events also disrupt access to sexual and reproductive health and rights services, access to school education, and lead to increased in gender-based violence. Moreover, systemic gender inequalities lead climate change to disproportionately affect women compared to men, given the lower economic status, which diminishes their ability to cope with the climate effects. Climate change, therefore, not only threatens to further slow down and reverse the progress made in the past decades on maternal, newborn, and child health, but also could drastically reduce effects in terms of how the future generations will be facing these issues. Unfortunately, at the core of these numbers lies an additional and worrying truth. The countries that have the highest numbers of preventable maternal, newborn, and child mortality are also the countries which are at the highest level of climate risk. At the partnership, we are fully committed to addressing this intersection and have been mainstreaming the climate work across our advocacy over the past years. Central to advancing this intersection and integration of climate into women, children, and adolescents' health policies and inclusion of women and children in climate mitigation and adaptation plans. This conversation that we will have today will serve as a call to action to mobilize partners in both climate and health sectors to ensure that women, children, and adolescents are not left behind in the climate crisis. There is a need for policies, financing, and services to address the unique impacts of climate change on pregnant women, newborn, children, and adolescents to ensure that we are still on course to meet the commitments that we made in the Sustainable Development Goals. Colleagues, let's begin this important conversation. And it is my pleasure to firstly invite from the Ministry of Health in Malawi, Dr. Matthias Joshua, who is representing the minister today because the minister is held back in the parliament. And Dr. Joshua will be speaking on the effects of climate change as are being witnessed in Malawi on women, children, and adolescent health, and how Malawi is trying to address these issues across the spectrum. Over to you, Dr. Joshua.
Thank you very much. Let me welcome all to this very important meeting. On behalf of the Honorable Minister, Honorable Kumbizeka Ndodo Chiponda MP, I would like to give this speech. It is my honor for me to be part of this important high-level dialogue addressing the impacts of climate change on maternal, newborn, and child health, and building climate resilient societies. Let me thank the organizers for inviting me to be part of this important event. Malawi is one of the most vulnerable nations to the impacts of climate change. From 1980 to date, there has been an increased frequency of extreme weather events and disasters in my country. As we gather here, I am reminded of the devastating floods that swept through our nation in 2015 to 2022, and recently in 2023, leaving thousands and hundreds dead and displaced. The most recent and worst disaster due to climate change being tropical cyclone Freddy. This cyclone had more than 2,267 people affected, of which 659 were displaced. 679 died, and 537 got missing. And there were a lot who were injured, coming up to 2,178. These effects did not spare pregnant women, newborn babies, and children. Climate change has brought about health impacts of varying degrees at all levels, affecting maternal, newborn, and child health in Malawi, such as increased incidence of climate-sensitive diseases, such as malaria, diarrhea. We had a lot of outbreaks from cholera, and malnutrition, which has some of the leading causes of death in children. Loss and damage of health infrastructure and water, sanitation and hygiene facilities, leading to disruption of all water and sanitation activities, including reproductive and child health services such as antenatal and immunization. Damage to roads infrastructure, thereby making it difficult to access outreach clinics and the referral of pregnant women and children. There was also destruction of ESCOM power grid, hence this is a national grid, hence loss of electricity rendering to discontinuity of vaccine supply and also supply chain management. The following are some of the strategies and interventions which Malawi is doing to address some of these impacts of climate change on maternal health and child health. Community approaches. We have developed case management for all the diseases, and we have also got community sensitization in hygiene practices using community-led total sanitation strategy. We have done management of malnutrition, long-lasting insecticides treated nets, and indoor residual spraying for malaria prevention, targeting pregnant mothers and children, among others. We have strengthened preparedness and response mechanisms to climate-related health emergencies, such as improving early warning alert and response systems. We have also provided menstrual hygiene facilities in schools and other public institutions. We have done promotion of water and sanitation facilities and technologies that are resilient to climate change. We have done investment in climate information services, establishing functional emergency response teams, and conducting regular drills and simulations. We have done capacity building of frontline health workers to be able to provide health services, including those under maternal and newborn health. In humanitarian settings, originating from the impacts of climate change. We have done construction of climate-proof and resilient health infrastructures in order to withstand and extreme weather events. Following strategies are considered for intersectoral actions and financing to leverage resources to increase alignment and investments in safeguard maternal, newborn, and child health in climate change. We have done mobilization and domestic and international climate finance for health resources to address impacts of climate change. We have enhanced collaboration between health and environment sectors in accordance to the Libreville Declaration on Environment and Health of 2008. And we have taken concrete actions on climate change affecting maternal, newborn, and child health. We have supported climate resilient social protection programs, promoting climate-informed health education and awareness, and ensured that climate change adaptation and mitigation efforts are inclusive and equitable. On the guiding policies and the documents on climate change and health, Malawi has the following in place. We have a strategic document we call the Health Sector Strategic Plan 3, which is running from 2023 to 2030. And in this document, climate change and health is one of the priority areas under this strategic document. Especially the pillar 3, this pillar talks of social determinants of health, and one of the determinants of health is climate change issues. This guided by this document, we are taking steps to integrate climate resilient and health, including through the development of adaptation strategies that enhance the capacity of our health system to respond to climate-related emergencies. On vulnerable and the adaptation assessment on climate change and human health, this one we have formed the basis for some of the mitigation measures on climate change and the health as mentioned above. Malawi Health and National Adaptation Plan on Climate Change. This forms part of the plan for addressing issues identified in the V and the AA. National adaptation contributions, where health sector is one of the priority sectors in the document. National environmental health strategy policy on climate change and the health is one of the core thematic areas in this document. A policy brief on the burden of impacts of climate change on public health. However, it is important to mention that the policy on climate change does indirectly incorporate health issues, including maternal and newborn and child health. Furthermore, other existing health policies, guidelines, strategies, and plans lack integration of climate change and human health issues, including those affecting maternal, child, and newborn health. In order to address the impacts of climate change on maternal, child, and maternal, newborn, and child health, the following should be considered. We need to integrate climate change issues in maternal, newborn, and child health policies to ensure mothers, babies, and children are not left behind towards achieving our sustainable development goal 3.1 and 3.2. The health sector should strengthen adaptation and mitigation measures for climate change, sensitive and related diseases. And conditions such as malaria, diarrhea, malnutrition, and others are based on seasonal variation of climate variability and disease instances. The health sector, in collaboration with relevant sectors, should develop climate resilient health programs, mitigation and adaptation measures to deal with effects of climate change on maternal, child, and newborn health. In conclusion, let me urge everyone to consider integration of climate change issues in health policies and specifically maternal, newborn, and child health policies so that we build a climate resilient society. This can easily be achieved through multi-sectoral approach. Lastly, I would like to use this opportunity to thank all our partners for the support they give to my country in adapting and mitigating the effects of climate change, especially on maternal, newborn, and child health. I would like to thank all of you for your listening to this speech. Thank you very much.
Thank you. Thank you very much, Dr. Joshua, for those remarks and for outlining the efforts undertaken by Malawi in terms of addressing the complexity of challenges that climate change poses to health and particular initiatives that you have outlined with regards to women, children, and adolescents. Sincere thank you to speaking on behalf of the Honorable Minister and joining us today. Colleagues, before I hand over to my own boss, WHO Assistant Director General, Dr. Bruce Aylward, just to remind you that we have 3 segments of this discussion. The first segment, which we are in right now, are keynote addresses. We will then move into the framing conversation, which will be then followed with a panel. Do get your questions ready. Use the Q&A or chat features. We will do our best to come back to your question and pose them to the panelists in different segments. Bruce, over to you. And how do you think we can use the World Health Assembly resolution to drive impetus to bringing this interconnectedness that Dr. Joshua also talked about, but bring in some level of specificity to address women, children, and adolescent health issues and declining progress on mortality due to climate change? Over to you, Bruce.
Thank you very much, Rajat, and good morning, good afternoon, good evening, depending on where our colleagues are in the world who are joining us today. Delighted we see, I think we are over 300 people now online, so a great mix of climate champions and also maternal, child, and adolescent champions. And Rajat, to your question, and maybe just to orient everyone on the call, last year, so it's less than a year, the World Health Assembly passed a major resolution. The ink isn't even yet dry, and it was about the horrific state of maternal, child, and adolescent health in the context of the SDGs. But for the first time it linked that, the horror of that stagnation, to the specter of the escalating existential threat of almost of climate change. So it brought these two things together to answer your question in a nutshell, Rajat, these two big agendas. So that was really the crucial thing that it did. And this is so important because if we've learned one thing looking back, we make great progress on the maternal, child, adolescent agenda, newborn agenda during the MDG era. And I think, Zulfi, you might refer to this a little bit when you speak. We made great progress. And then we went into this era of stagnation because we weren't looking forward. What is going to happen next in the world, in the geopolitics, and those other factors? How are we going to keep advancing this agenda? And so what this resolution from last year did, it looked as much as any of us can into a crystal ball to say, what does the world look like going forward? And quite frankly, as we'll hear described by Maria and others pretty soon, if we don't act, it does not look as bright as we hoped it would by the time we get to the end of the SDGs. So the importance last year of this resolution was that 194 member states, for the first time, they said, yes, these two things are linked. And for those of us in the maternal, child, adolescent health community, great champions of that, we realized in that resolution that the same people that we are trying to help in the same places where we're trying to emphasize, and Zulfi, you'll talk a little bit about the FCV areas, for example. Well, these are the same places where climate change are going to hit hardest, and they're going to hit some of the key levers that we need to move this agenda the hardest. So we would be doing well to remain stagnant in where we are. And I think you used the point, Rajat, in your opening comments, that we risk reversals in the face of the climate agenda because of the compounding vulnerabilities of climate change and the impact that has on the vulnerabilities of the populations and places we're trying to work. But the second and more positive aspect of the resolution, and it's not immediately obvious, you have to look into that, but what we see is a great symbiotic relationship between the climate community and the maternal, child, and adolescent community. And that's the reason we've got some giants across both of them, straddling both. But there are big, let's say, gains to be made working together. To advance the maternal, child health, and adolescent agenda, today we are talking about how do we switch health systems to a primary health care approach? How do we really move the workforce agenda, health and care workforce? How do we really ensure resilient, robust supply chains, et cetera? All of these are fundamental to resilience in the face of climate change. And I say that because there's always a risk, and you're going to hear it today when you get world experts like Soumya and Zulfi and Maria talking about climate change, and then Ellen and others are going to weigh in, and Francesco. There's a risk that you think, that's over there. But so many people in the PMNCH world are already climate champions, and you don't realize it because you're already working on the fundamentals and trying to advance things that will build resilience. And that's part of what's in that resolution, Rajat, of last year. So WHO, I want to say from our side, we really get this. We've just launched a new global health strategy in consultation with so many of you on the call today. As you saw, the first strategic objective there is advancing the climate and health agenda. So we get that. And if you dig into that specific area, the first strategic objective, it singles out one area, which is maternal, child, and adolescent health as that special risk as well. So we're building already, Rajat, I think, on that resolution in that regard. So the last point I would just make is just today is unique. We've got two fabulous, committed, passionate communities coming together, the climate community, the PMNCH community, and people who work across the both of them. And as we look forward with a challenge like we've just been describing, and I think which Dr. Joshua laid out so clearly from a country perspective, you cannot address challenges on this scale without extraordinary partnership. You've got to work together. And in this space, we have to be working together around how do we catalyze, and Zulfi, I think you'll dig into this, around building the, the evidence base isn't super strong. We think we know what the implications are, but we've got to strengthen that. But then secondly, we've got to amplify the urgency, the importance of this agenda, and also those populations and places that are at a special and compounding risk due to the reality of climate change, because it is just that, a reality that we are trying to work within. So with that, Rajat, this is why the resolution provided us a great springboard, but we've got to make sure we take advantage of that springboard now to affect these agendas. We've got the best of MNCH here today. We've got the best of the climate change agenda, and I think if going forward, PMNCH can get us on, the best possible road for synergies on this agenda, that'll be a fabulous outcome to get aligned ahead of this agenda rather than behind a little bit like we were coming out of the MDGs for impact for some of the most needy populations in the world. So with that, Rajat, thanks so much, and really looking forward to hearing people who know more about both of these topics than I do.
Thank you so much, Bruce, and really for emphasizing the point that how we need to bring these discussions more closer together. But importantly, as you outlined, how we at World Health Organization are embedding these aspects together through the GPW 14 that you mentioned, but also how we are trying to do that by concertedly bringing attention to maternal, newborn, and child health issues and achieving acceleration. And one key determinant of that this year is DG announcing the World Health Day this year, which is going to focus on maternal and child health. And that's, again, a clear opportunity for us to champion these issues and to bring these agendas together. Great pleasure now to welcome Francesco Vera, youth climate activist and founders from Gardens por la Vida. Francesco, you've been at the front line of this activism for long now. Over to you for your thoughts and reflections as a keynote speaker for the first segment of our conversation. Thank you, Francesco.
Well, thank you so much, Rajat. It's a very nice opportunity for me to talk about the special vulnerabilities that children, adolescents, and youth in general have in the context of the climate crisis we are living across the globe. So thank you so much for the opportunity. Well, I think children and adolescents are basically the most vulnerable. I don't think actually evidence and facts show us that they are at the core of the climate disasters and climate affectations, not just because they are more vulnerable physically and physiologically, but also because there is another big picture in the context of our current society. No, let's say when we talk about health and climate change, we are talking about like the small picture. But then if we look at the rest of the issues that children and women and adolescents have to face, we have another approach. No, so basically what I'm trying to say, or what I'm trying to introduce is the concept of negative feedback, basically. No, climate change is just one of the threats that children have to deal with. Basically, we have at the same time ongoing armed conflicts and also historical inequalities and poverty and economic challenges and gender inequalities that also reflect in a very difficult reality and livelihood for children and adolescents across the world. No, so in the context of marginalized communities and for example migrant children and also children in armed conflicts, they are even more affected than the ones that are in let's say living in peace. No, basically all these factors come together and are sinking the future of children with this concept of negative feedback, basically a negative cycle that is just simply sinking the hopes of children, which also leads to the worst of the crisis for me, that is the hope crisis. No, this mental health crisis that also is reflected due to the extreme weather events today in 2025. Children that were born in 2020 are living up to 7 times more extreme weather events than the ones that were born in 1960. So I don't know how old are you, Rajat, but maybe your generation or some generations before you do not have to live with this kind of issues that of course affects deeply and directly child health and well-being basically. Additionally, I think that that's why it's so important to invest and also have in our public policies child sensitive and adolescent sensitive approaches, basically taking into account their voices and taking into account their unique vulnerabilities in front of the climate crisis and the other current crisis we are living as a society. We need to be at the center of the solutions. And in fact, we are already in our communities mobilizing our collective efforts to make a change in our realities. For example, I know that is connected from the audience a very nice group of youth from Mexico, from Monterrey, that are fighting for air pollution in their city, in a city where basically air is unbreathable and is unbearable due to the pollution, due that we have created cities basically planned just for cars and not for citizens and people. This is the question, no? Investing in the well-being of children and adolescents is not an option, but is actually an obligation that the states have, because this also involves human rights. No, when we talk about this climate crisis and this climate injustice, which is also generational and intergenerational injustice, we have also to take into account this human rights based approach. No, this is also a human rights crisis, and I think human rights are non-negotiable. No, especially this essential and fundamental right to have a dignified and clean and sustainable environment. But even letting that aside, when we invest in child well-being, we gain as society basically, because we are first of all preventing the loss of livelihoods and of life and human potential that may be lost because of the climate disasters and climate extreme weather events. No, so basically my message is to involve children, to engage youth and adolescents in all the, let's say, the stages of projects, from the designing and the planification of finance until the execution. We need to be at every single moment of the climate action basically, and we need to be part of the discussion, not just in the sense that we are the most vulnerable, but also with another approach, that is that we are the change, and we are the only generation that can really make that change possible. No, and if not, we'll suffer the most let's say the biggest consequences of our own action or our action. So this is the message. Let's continue fighting as our colleagues from Monterrey are doing, and thank you so much.
Thank you. Thank you so much for that, Francisco, and really applaud your courage and your commitment for doing what you do. This is rather extraordinary. And where you left us is that you are the only generation that can make the change, but also the generation that has to deal with the compounded effects of climate change in the worst of manners that we are leaving behind. Appreciate very much the emphasis that you brought on the meaningful adolescents, young people engagement, and the importance of that on how we do that across the spectrum at the partnership. As you know, adolescents and young people is the largest constituency that we work with, and very much looking forward to working and deepening this conversation with you. I see an enormous amount of chat and dialogue happening within the Q&A segment and in the chat. Thank you, colleagues, and please do keep on going. There are questions about guidelines, tools that are available, implementation plans, etc., which is a great segue to the next segment of our conversation, which is framing remarks from three world leaders, if I may say so, of extraordinary experience: Dr. Maria Neira from the World Health Organization, Dr. Swamya Swaminathan from MS Swaminathan Research Foundation, and Dr. Zulfikar Bhutta from Aga Khan Foundation and Sick Kids as well. Thank you so much to the three of you for finding time and joining us. And if I could start with you, Maria, for your reflections on the trends affecting climate change and health, and where you see the opportunities for us to move forward. Thank you, Maria. Over to you.
Thank you, Rajat, and thanks for organizing this fantastic panel. I see that we have now 318 people connected and very active on the question, so I don't want to lose one of them, so I will be a little bit provocative. Starting saying hello to Francisco. Hola, Francisco. He's our Che Guevara at the moment, but I have been telling him that one day he will be the Secretary General of the UN, and he's working for it. I will vote for you, although I will be too old for that. But we wait for you in Colombia, Francisco, in 1 month from now, and this is an information for everyone. 1 month from now, we will have the Global Conference on Air Pollution and Health, organized by WHO in collaboration with the government of Colombia, where obviously the issue that we are discussing here today, and as Francisco was mentioning, the issue of air pollution affecting very much vulnerable population, and we can expand on that, but I think it will be extremely important if among the participants you are engaging to that. Very quickly on the 3 minutes I have, Rajat. First, thanks for organizing all of this. Let me start by the end. The end means that your objective here today is to reduce mortality and bolstering the health of women, children, and adolescents. And my answer to that is yes, we can do that if we join the forces of the climate change and health community on the strategies we are putting in place. I can assure you if we apply all of those strategies, one of the immediate benefits or medium and long-term benefits will be on maternal and child and adolescent health. How? And again, I will start by the end. The end is the strategy we are putting in place. One, we know very well that climate change is affecting our health in many different ways. And of course, the women and the children will not be protected, and adolescents, at the contrary, will be more vulnerable. So what do we need to do? We need to do adaptation. We need to make sure that we prepare our health systems to be more climate resilient, low carbon, sustainable, and that will be good for controlling malaria, for controlling dengue, for maternal mortality, for assisting much better the woman that is about to deliver. This is fundamentally a no regrets investment, the adaptation, the climate resilience. The second thing we need to do is mitigate. Obviously, we need to tackle the process of climate change, reduce carbon emissions, and make sure that we ensure the transition to clean sources of energy. We need your help on that. We need to ensure that the sources of energy that we will be using are not longer. We need to transition as soon as possible to renewables, to clean sources of energy, the ones that will not contribute to climate change and will not contribute to the causes of air pollution that represent such a big problem. We need to transition to sustainable food systems, and the children and mothers will be enormously benefiting from that. And we need to transition to a healthy urban planning in our cities, reducing sedentary lifestyle, promoting a less exposure to air pollution, and many other benefits that reducing exposure to heat waves and any other things. And of course, we need to do negotiations as well. And that's why we are very much engaged at the COP negotiations. G20 approved a resolution on climate change and health, our own resolutions at the World Health Assembly with all the ministers, Green Climate Fund, all of these global issues. We are making sure that we are very much part of that from WHO and all of our partners. And of course, we need to talk, and this is, Rajat, extremely important for your community. Please get familiar with the NDCs. NDCs is not non-communicable diseases. NDCs means National Determined Contribution, the National Adaptation Plans. Please, we are trying to incorporate very heavily health into that. But this is the way the countries will be responding to the issue of climate change and protecting our health. So fundamental to do that. Of course, the alliance with the air pollution community is fundamental. For us, is more or less the same agenda. And the importance of doing a network, bringing all of these groups during the COPs. We have such an incredible amount of network supporting, doing advocacy, policy, influencing our governments, because at the end of the day, what we need to do is to reduce those emissions. And of course, ATTACH. I'm very happy to see that ATTACH has been one of the co-sponsors, and is fundamental because this is the platform that gives us such an incredible opportunity to exchange and to promote and to go for more information and more action and reduce our own carbon footprint. You know that the health system is responsible for 5% of the global carbon emissions. So we need to reduce that, and we are already putting in place a strategy that is very, very stimulating for those countries that are contributing to the carbon footprint. There are many countries like Malawi that are not contributing to the carbon footprint, but they still need to gain access to electricity. But instead of doing it with polluting sources of energy, they can do it with solar energy that we are now scaling up the access of healthcare facilities to solar energy. This is good for climate change. This is good for air pollution. And more importantly, this is extremely good for providing the services that we want the healthcare facilities to provide, particularly for pregnant women when they are coming to deliver and there is no electricity and all of that. So plenty of actions that we can join, and of course, an incredible mission and passion that we have in front of us, not giving up. At the contrary, now more than ever. So Francisco and others, we need to join forces and be very, very strong because we are very relevant. Thank you so much.
Bravo, Maria. Bravo. Now more than ever, I think if there is one thing we should take away from this conversation should be that. But also thank you for emphasizing the veracity of issues that you did, but bringing home the point about the importance of bringing movements together and working together and building alliances, not just in terms of shifting global norms and standards, but achieving the kind of national level adaptation and mitigation measures that are required. You raised a very important point, which came up in the Q&A as well, is the importance for the need for clean energy solutions and how those are important across the spectrum of issues that we are talking about. There have been questions also about issues in terms of scientific research, particularly addressing adolescent health needs, etc. With that, let me now come to a second framing remarks from you, Dr. Swaminathan. Soumya, you've been at the forefront of these issues. You've been part of multiple research initiatives. And we wanted to ask you if you could share your reflections on the evidence, but also research gaps that you think when we look at the impacts of climate change on maternal, newborn, and child health. Over to you, Soumya, and welcome again.
Thank you. Thank you very much, Rajat. And it's indeed wonderful to be with you all today and talk about this absolutely critical issue. So let me start by a few remarks about the findings of a scoping study that we did last year in India that was commissioned by the Ministry of Women and Child Development to look at the impacts of climate change on women and children. And we looked at health, of course, but we also looked at livelihoods and education and other kinds of impacts. And what we found was that more than published evidence, of which there's a growing literature, that we collected a lot of anecdotal evidence, grey literature, women's groups, as well as civil society organizations working, and found that there's such a huge impact on women and children. To give you a few examples, we looked at data from our National Family Health Survey and overlaid it on the map of India and looked at districts that have been impacted by drought, for example, over the last 10 years, and looked at what happens to women's, some of the health indicators. And we found that women's underweight increased by 6%, for example. Girl-child marriages went up by 3%. Intimate partner violence went up by a whopping 26%. and dropout from antenatal care went up by 36%. Similarly, miscarriage and stillbirth went up by 6%. These were in districts that had been repeatedly exposed to drought. We also found that in some cases, urban indicators were worse than rural. When we looked at women, at children and exposure to extreme hydromet disasters, so this was either a drought, cyclones, or floods, we found the child underweight went up, diarrhea among children went up by 20%, minimum dietary diversity came down by 28%, child immunization rates dropped. So again, this and also a lot of evidence about school closures, because whenever there is a climatic incident, or even when there are high pollution days, for example, in some cities, one of the things they do is to close schools. And we know how badly that impacts children. And already many children have gone through 2 years of school closures during COVID. And on top of that, schools close again because of climatic hazards. Now, there is, of course, a growing literature on the impacts of heat, particularly on pregnant women. And some of the experiences we heard about from some cities in India which have had severe heat waves in the past, and we see this growing every year now, that simple things like moving maternal and child wards off the top floor and moving them to a different part of the hospital, particularly in buildings which do not have air conditioning, can actually save newborn lives. There's also been work done to show that there are some simple interventions, and building more awareness in the community can have positive impacts on reducing these kind of morbidity and mortality. So what we have seen last year, in fact, is an increase in heat-related mortality across the board. That, of course, includes women. But the fact is that a lot of people in developing countries cannot afford not to go to work just because it's hot. And some of us have better protection, we have good housing, we may have access to air conditioning, but there are billions of people worldwide who do not, unfortunately, and those are the exact places where these kind of hazards are increasing. Now, I just want to spend 2 minutes on the solutions, because I think we know the problems now quite well. And of course, we're learning more. There are research gaps. One research gap I'd like to talk about is on the impact on nutrition. There's much less work that's been done on the impacts of climate change on maternal and child nutrition and food and nutrition security. So that's an area. The other area there's a gap, I think, is where the solutions, particularly cost-effective and affordable solutions that can be implemented in LMICs, specifically for heat, but also for some of the other climate hazards, and urban planning, again, in an affordable way, where we can conserve energy, but also reduce urban heat island effects, and ensure availability of water and shelters, cool shelters, and so on. I think there's a lot that needs to be done, particularly in high-density cities. Now, in terms of what can be done at the national level, I think we need to start, of course, from national guidelines and governance and policy and financing. But even more important, I think, is to go down to the state and sub-state levels. In India, we call them districts, could be provinces, of course, the towns, cities. So local bodies, the councillors and the local bodies, they need to be involved. And recently, I was at a meeting in New Delhi where it was an international meeting, and we had examples from cities around the world where they've appointed city heat officers. And this results then in a focused attention on the problem of heat. And this person works across departments, because again, we know that in the case of climate change, action in the health sector alone, while important, is unlikely to have the kind of effects that we want to see. So we need labor, we need the education department, we need the town planning, people who are building more houses, we need the water department, we need renewable energy. So literally we need, and of course you need finance. And so you need all of these departments to come together and actually have a plan as to what we're going to do when the temperature hits a certain degree. The other point I'd just like to mention on the research gaps is really to look at the combination of things. It's not just the temperature alone that affects us biologically. It's a combination of temperature, humidity, wind speed, and how long you're exposed to. So we're undertaking some research now to look at how communities differ in their response when there is dry heat versus humid heat, because your early warning systems today that can be driven by AI actually need big data sets. And finally, I'd like to end with a call for creating climate and health data hub, because we lack that kind of granular data especially from the LMICs. And without that data, it's very hard to convince policymakers and politicians to act. And so we're also making efforts in India with like-minded academics and NGOs to create this kind of climate and health hub. And that in turn will help us to drive early warning, both for healthcare providers, so they can step up and be prepared for whatever's coming, but also to communities, particularly to women, so that they know how to protect themselves and their families. Thanks, Rajat. I'll stop there.
Thank you. Thank you so much, Soumya. That's very, very helpful. And thank you for taking us through both in terms of the research gap, but also the kind of strategies and the work that is being done. And you touched upon a few things that were popping up in the chat as well in terms of need for better data, the strengthening of data, which both Bruce and Maria talked about as well. But really appreciate the point that you made remarkably is about the need for thinking through more localized solutions and looking at different levels at which the problem manifests and differentiated impacts with which it is affecting women and children, and the way the solutions are being built from policy to investment plans, but also to infrastructural dimensions that you touched about as well. And that brings me to Dr. Zulfikar Bhutta, professor and founding director for the Institute of Global Health at Aga Khan. Zulfi, you've been at the forefront of a lot of these issues and a champion for years now, talking about these things. And one of the things I have always heard you remarkably say, that these issues don't affect everybody equally, and that there are differentiated effects of these issues and the way they work out, and particularly the point about fragile context and how that affects women, children differently. So over to you for some further reflections, but also adding to what you have heard thus far, in case you would like to add to that. Over to you.
Well, thank you very much, firstly, for the opportunity to be with you. Secondly, in this August gathering of fantastic speakers, is to lend some additional points to this entire issue. And I'd like, in the interest of time, to make just 5 succinct points, if I may. The first is that our knowledge of the relationship of climate change, and particularly the effects of heat in terms of maternal and child health outcomes, is growing exponentially. If you look at the amount of information that we have now, from just conjectural association data to actually longitudinal data to data that comes from robust analysis, has virtually trebled in the last 3 years in terms of both quality reviews and also associational data. And it says several things to us. So first important thing is, while we have the direct and indirect effects of climate change on maternal and child health, direct manifested by direct exposure to heat and some of its effects, and indirect through impact on things like food security, emergencies, disasters, what we have begun to recognize is that they are all influenced by pre-existing conditions, social determinants, and drivers that make the impact of some of those conditions much worse in circumstances. So you asked, why are women and children more susceptible? And we recognize that in many geographies, there are gender differentials in terms of exposure to the effects of heat. Women do not have the same opportunities for adaptation and for modifying their schedules and work as men do. And also, children in many circumstances just don't have the same resilience to adapt to the environmental temperature and the impacts of climate change as others. So the role of social determinants, and particularly gender inequalities, are huge. The third point that I would like to underscore is that climate change is a threat multiplier. And as you alluded to, and Francesco said this as well, some of the countries' populations worst affected by the impact of climate change are populations affected by conflict, by population migration, extreme food insecurity, long-term droughts, complicated by, at times, other emergencies. And therefore, in that circumstance, to look at climate change in its narrow sense is not only impossible, but is perhaps inappropriate. We have to look at this in the context of all other ecological factors that influence it, and it is indeed possible to do that. While we have focused on the direct effects of climate change, we also recognize now with increasing evidence that there are also long-term effects, and their impacts of slow and steady climate change in addition to the extreme heat events. So one should look at the totality of the evidence, and certainly from data that we have published recently, and Soumya may want to see that, is the relationship ecologically and temporally over time of increasing temperatures in various districts of Pakistan on child stunting and early wasting. And those relationships are not just because of ecological impacts on food production or agriculture, but they represent a long-term exposure which may actually have maternal fetal dimensions. The next point that I would like to make is that there is a need to understand the biology. So while we have all of this epidemiological information, and some coming from very robust studies from demographic surveillance sites and longitudinal cohorts, there is the need to add to that by an understanding of biology, physiology, and some of the mechanisms that underpin potentially future interventions. And interventions are indeed possible. Early data from Pakistan indicate that in women at risk of fetal growth retardation in relation to heat exposure in early pregnancy, you could obviate some of that impact by appropriate nutrition interventions, and also adaptation in terms of lifestyle, work, and antenatal care. So what we need is implementation and an action agenda complemented with the right kind of research to fill in the evidence gaps that we have, both in terms of understanding the direction of travel and also some of the methodologies and mechanisms. And that's where all of us in academics, research, and funding bodies need to come in. Finally, I would like to move to add to the points that Soumya and colleagues were making on the fact that we don't have to wait for solutions in the future, but we know sufficiently at this point in time to work towards adaptation and resilience building, particularly in a context that global mitigation strategies might be impacted by some of the political changes that we see around us. And I don't think they're going to impact many of the outcomes for poor women and children in Africa and Asia in the short term. So there is clearly an implementation, research, and learning agenda around what can be done both in urban populations and rural populations on working with communities in a well-designed set of interventions that can help mitigate and reduce some of the burden of climate change on health and development outcomes. And I completely concur. This would need to be a multi-sectoral approach, not just on looking at health in isolation, but on the education sector, on the role that social protection sectors can play in this, and importantly, in rural populations, on the lives and livelihoods of people who are agricultural workers, people who are also working in the formal work sector. I'm reminded of this recent study in Tamil Nadu in India, where some of the most egregious effects of exposure to heat were seen in women who were also exposed to extra work burden in extreme heat periods. So we need to bring in the social protection sector also for women, and also look at what work exposures and labor laws can afford as protection. My last point is none of this can be done in isolation by either the research sector or the academic sector, or for that matter, NGOs. This requires partnerships increasingly in geographies and countries which are transnational, which are supranational. And therefore, we need to work together in various geographies to learn from each other's and to implement models of care that will make a difference, exactly like what was done decades ago for addressing the global challenge of maternal and child survival. Bruce started off by saying how things have plateaued. Indeed, progress in many areas has, if not regressed, slowed down considerably. And it's not just due to the factors that were highlighted as perhaps lack of resources or slowing down on investments. It's also because as we reduce mortality, we come to the hard core of factors and effects that impact adverse outcomes for women and children that do relate to environment and ecological factors, for where there is no easy fix. There is no solution that can be just given in the form of a pill or an injectable or a device. It requires collaboration in terms of implementing strategies at scale in populations trying to reach the most vulnerable and the poorest of the poor. Thank you very much for your time. I'd be happy to take questions if there is an opportunity.
Thank you. Thank you so much, Zulfi. You're joining late in the evening from Cambodia. and really appreciate the time that you've taken to join us. But the veracity of issues that you have raised from identifying the way the evidence and the knowledge base is expanding to the gender and intersectional inequalities. But I think where you landed us towards the end is that we cannot look at these issues in isolation from each other, and the need for strong transnational partnerships to ground what we need to achieve in this regard. This is a very helpful segue into the final segment of our conversation, the panel discussion. We have 4 remarkable speakers who will be joining us for this last segment of the conversation. And a lot of you have been asking, the kind of issues from decarbonization of health sector, for looking at issues in terms of research gaps, for intersections between gender and disability, role of education sector, and other areas as well. And I hope the panel, as it shares their reflection, will try and ponder on these aspects as well. Great pleasure to introduce the first panel member, Alan Dangor, Director for Climate and Health from the Wellcome Trust. Alan, welcome. And it's really remarkable to have you with us, but also really thankful to all the work that you and the team at Wellcome Trust are doing to facilitate work and research and evidence on this area. And the question that we wanted to start with you as the first panel speaker is, how can we advance intersectoral evidence-based policy and action in order to ensure that women, children issues are integrated as part of the climate crisis response? Over to you, Alan.
Thank you very much, Rajat, and thank you indeed to the partnership for this very kind invitation. I'm going to copy my dear friend Zulfi, and I have 5 points, but given the time and where we are, and I'd love to hear from all those people online, I'm going to keep it very brief. So the first thing is, I thought that Dr. Joshua's intervention at the beginning was hugely powerful. Malawi really is a poster child, not only for the dramatic impacts that climate change can have on human health, but also, frankly, the amazing ability of the Ministry of Health to respond. I think it's hugely important to see how those policies can be, health policies can be informed and need to be informed by climate change, so that responses are ready, that the health systems are resilient, and that integration is critical. So I think we can all learn a huge amount from Minister Chiponda and the Ministry of Health in Malawi in its extraordinary ability to tackle the impacts of climate change, especially on maternal and child health. The second thing, my second point, is that Wellcome, as I hope many of you will know, is a funder of research primarily, and I'm really honoured to be leading the work on climate and health. We have requested and are funding many partners, many on the line. In fact, it's lovely to see some colleagues on the line today. To conduct research on the impact of extreme heat on maternal and child physiology. It was one of the first things we said. We need that underpinning science to really help us understand what the biology of some of these impacts. But we also fund a repeated call, and we have one live at the moment, for research on the impacts of climate change at the local level. And many of the applications we've had in relate to maternal and child health and nutrition. And I thought it was fantastic to hear Sumia's points that she made about the importance of that evidence base and that growing evidence base. My third point then is that it's very helpful to note and to quantify the impacts of climate change on human health, but more important is to find solutions. And so we are also working very carefully at the moment to think about how we can synthesize the evidence that comes in a more effective way, live evidence, living evidence synthesis, so it's more timely, it's more inclusive, and especially that relates to the solutions. What are the adaptations that will protect health? What are the mitigation actions that are the best for reducing the impacts and having those co-benefits for health? And we support something called the What Works Climate Summit last year in Berlin, and there'll be another one next year. And we're very excited to bring together the solutions community to identify those the body of evidence as it emerges. My fourth point is that academia is really brilliant at writing research papers, and if the problems of the world were to be solved by writing research papers, there would be no problems because we've done it. Of course, the challenge is to make sure that that evidence is relevant and that that evidence is really embedded and used and demanded by policymakers. So that pathway to evidence, from evidence to policy, is critical. And we are shaping our program at Wellcome to ensure that the research we are requesting and we're demanding from our partners, our grantees, to ensure that that evidence moves directly, has a pathway to move into policy, because that is so critical. And finally, the point that everyone has made, partnership is critical here. So this is not a health problem. This is a climate and health, a climate-informed health problem. But even then, the broader partnerships are so necessary with the civil society, with indigenous groups, with other parts of government, with the transport sector, with the agriculture sector. And that cannot happen without partnership. And that openness and that willingness to be transparent about evidence, to share resources, to support each other to tackle this issue is critical. And that partnership is core to what we're trying to achieve at Wellcome as well. So those are my 5 points, Rajat. I'll hand back to you. Huge thanks again. I look forward to the discussion. Thank you.
Thank you. Thank you very much for that, Alan. And really, I think the importance of this conversation, the fact that Attach, a magnificent alliance of its own and partnership have come together, and bringing this together is the impetus for us to continue building that. And thank you for highlighting a point that I think you made it very eloquently, for us to having an end-to-end approach, not just ending with the research, with the doctrinal part of it, but looking at solutions, the policy measures that are required for us to do that. And which is a nice pivot to the next speaker, Miryanka Paul, Global Head of Health Policy and Advocacy, Save the Children. Welcome, Miryanka. And the question as I wanted to ask to you is, so what is needed to accelerate financing policies and programs on MNCH and climate change? And how do we ensure the participation of those affected in these processes to effect that? And if you could also reflect on some of the successful learnings from your engagements with, for instance, Lao PDR, where you've got projects, but also with Senegal and the Green Climate Fund. Over to you, Miryanka.
No, thank you very much, Rajat, first of all, for the opportunity to share Save the Children's perspective on this critical issue which really demands urgent global attention. And let me start with flagging that for Save the Children, the climate crisis is not just an environmental crisis, it is really an escalating and profound child health emergency. And I want to flag 3 key statistics that we flagged again, underlined in our recently published policy brief, which really underlines that. First of all, 88% of the climate-related disease burden falls on children under 5. Second of all, and that's been reiterated as well, women and children are 14 times more likely than men to die in climate-related disasters. And lastly, I would like to flag that without decisive action, there's estimates that 40 million more children will suffer from stunting and 28 million more from wasting by 2050. And I think those numbers, they do speak for themselves and really call for decisive action. And what we at Save the Children see that despite frameworks like the UN Convention on the Rights of the Child, the Sustainable Development Goals, climate health agreements, but also the WHO resolution on maternal, newborn and child mortality, acknowledging these threats, action lags far behind commitments. And I would like to give one example, which is on financing. Health receives less than 1% of multilateral climate funding, while the annual adaptation funding gap exceeds 11 billion USD. And partners like the Green Climate Fund, for instance, however, are working to bridge that gap. And I would like to flag, as you requested, some promising examples from our work with the GCF. In Laos, Save the Children is implementing the GCF's first ever health project, which supports 100 healthcare facilities and 250 climate vulnerable communities. And by integrating early warning systems and climate resilient healthcare, we are reaching 1.8 million people. In Malawi, you also flagged that we are scaling up climate smart maternal and child health services, really combining WASH improvements with innovative adaptation measures. And I think these projects that really show that targeted investment in climate health solutions can actually safeguard maternal, newborn, and child health. But we believe that the pace of global action actually must match the urgency of the crisis and the situation, and which is why we urge governments, the private sector, but also other stakeholders to take 5 decisive steps. First of all, that would be to expand climate health financing through grants, not loans, particularly for adaptation and loss and damage recovery. Secondly, and that's also been flagged already, it is on all stakeholders to mainstream child health in climate policies. And we've already referenced the integration of health into national determined contributions, but also into national adaptation plans, but also for governments to develop health national adaptation plans. Thirdly, it's about building climate resilient low carbon health systems, but also push for the disaggregated data that is needed to develop child responsive policies and reach those most marginalized. And fourthly and fifthly, it's about devolving decision-making to the lowest possible level and reducing bureaucratic hurdles to directly accessing climate finance, while lastly, and that's already flagged by Francisco, to institutionalize meaningful participation, because we want to ensure that marginalized communities, including children, have a seat at the decision-making table. And I'd like to end with a call to action. Safeguarding maternal, newborn, and child health amidst the climate crisis is a shared responsibility, and we've already flagged that. We believe that governments, donors, civil society, and the private sector must act now and together, not only to strengthen resilience, but really to advance justice. And that's something that Francisco, and thank you for your words, already flagged. Because children are our future, and our actions of today will determine their future's health and well-being. Thank you for listening and looking forward to the discussion.
Thank you very much, Marionka, and really very helpful. And I think there is something about the number 5 today. Everybody's talking about 5 action points that they are going in with. So, but without wanting to sound any bit facetious, really appreciate the emphasis that you made in terms of intersectoral collaboration, but also the fact of looking at justice-oriented approaches for us to move forward on these issues and build the synergies that are required for us to address the veracity of challenges. Zoni, over to you next, and for your reflections for the work of the Asian Development Bank. So very great pleasure to have you with us. Zoni Ballwood, Senior Social Development Specialist, Gender Equality Division at ADB. Thank you for joining us for Bangkok today, Zoni. Over to you.
Thank you. And I didn't actually count my points, so I feel the pressure now to try to fit them into 5 points, but I will try to be brief. So I think we've had a really fascinating discussion, and many of the speakers have actually sort of brought up many of the things that I wanted to focus on. But just to repeat a few things. Now, we have heard and we know that the women are at an increased vulnerability to extreme heat as well as children, and that we need tailored solutions in terms of adaptation. The second thing is that I think generally, there's an acknowledgement now with sort of the increase in data that climate change, and particularly extreme heat, really poses particularly health risks for women. Not just women of reproductive age, but sort of menopausal women, elderly women, and so on. So in that, to some extent, also has to do with sort of social, cultural, and gender norms and sort of women's economic position sort of in the countries and communities that they live in. And this is quite heartening, because when I was working on these issues 13 years ago, sort of looking at the linkages between climate change and gender, and particularly sexual and reproductive health, there was very limited data. So I think we have come a long way. And often when I used to talk about sort of how gender inequality intersects with climate change, I would sort of get a bit of a blank stare. And I think over the years, especially in the last, I would say 2-3 years, that has really changed. And so I think we have a better understanding of sort of that intersection. a couple of things that sort of have come up, the impacts also of extreme heat on mental health and gender-based violence, which I think, given that this is also a public health issue, there's an opportunity for us to focus also on the impacts of extreme heat and gender-based violence, but also look at how we may be able to prevent it. And as ADB, sorry? Okay. Can you still hear me?
Yes, Sonia, I think somebody's mic might have been open.
Oh, okay. And as ADB, a couple of years ago, we started our work on extreme heat. What we set out to do, first of all, is to look at the evidence that is there in terms of how it's impacting women disproportionately. And what we found is that there's sort of limited data from our region. So we set out to gather more data, particularly in the countries that we're working in. So that's Tajikistan, Cambodia, Bangladesh, Pakistan, Sri Lanka, and soon we will also add Philippines. And so here we have had a unique opportunity as an MDB to be able to bring together our government partners, as well as sort of our development partners and other stakeholders on sort of a dialogue around extreme heat. Then secondly, and sort of what they can do at the country level, at the national level, to address this issue. And so, now we're sort of moving into some of the solutions. And so what we are doing as ADB under this technical assistance project that I'm working on is that we are working with women farmers, for example, in Cambodia, looking at innovative cooling solutions and technologies to protect them. Secondly, we are working on early warning systems so that the early warning systems that exist are actually reaching women in the communication methods that they most use, because we know that a lot of countries are using sort of digital applications for their early warning systems, and that's not necessarily reaching women. So we have to also make sure that they are gender responsive and sort of reach women at the community level. Then we're working on parametric heat insurance, particularly focusing on providing parametric heat insurance for women in the informal sector and in the agricultural sector. And we're also working on supporting the development of heat action plans. So these are sort of either provincial or sectoral or city heat action plans that really are gender responsive, because even though there's now a long history of developing heat action plans in the region, not all of them are gender responsive. And so we want to make sure that they include the specific needs of women and girls. And then finally, we're working with UNICEF in Cambodia, looking at schools and how we can retrofit schools so that they're heat resilient. I'll stop there because I know we don't have a lot of time, but I just wanted to share some of the things that we're doing as ADB to really elevate, the work around extreme heat and gender.
Thank you. Thank you for that, Zoni. Remarkable effort. And then actually, the bit that I find particularly compelling in your presentation is how you're working with matching innovation with local level mobilization and bringing partners, civil society organizations, women group together to work in this synergy to drive solutions which are sustainable and longer term to some very complex challenges that you're facing in the countries in the region. Last but certainly not the least is my own colleague, Julia, who is not only the drive behind much of this work at the partnership, but also our conversation today. And great pleasure to have you with us, Julia. And I think we would like to end the conversation that we've been having today with your reflection on young people's efforts on driving intersections between climate and health. Over to you.
Many thanks, Rajat, and thank you again for all the panelists for the insightful conversation today. I think maybe just to sum up what colleagues have already said before me is that climate change is truly one of the greatest intergenerational injustices of our times, because those who have contributed least to the greenhouse gas emissions, such as newborns, children, and especially future generations, will be amongst the most impacted during their lifetimes. And this is why children and young people are extremely concerned about climate change. PMNCH has coordinated the What Young People Want survey, which has collected the responses of around 1.5 million young people aged 10 to 24 around the world. And many young people really mentioned climate change and environmental determinants of health, such as, for example, the need for clean water, tackling pollution, and tree planting as really key priorities for them. I think as young people, we are angry, we are scared, and it is really unfair that we are left to clean up the mess that those who have come before us have created. Understanding really the existential threat of climate change to our health, we recognize that current policies and targets are really falling short of what is needed, and often they perpetuate existing injustices across the world. And therefore, we're seeing that young people across the world are really driving climate solutions through a rights-based approach. And together with the work that we've done with colleagues and partners at PMNCH, we have really collected evidence of how children, adolescents, and young people are really driving both traditional and innovative methods to call for climate justice. For example, organizing climate strikes, public demonstrations, social media campaigns, school programs, peer-to-peer capacity strengthening activities, also advocating for the inclusion of climate change in school curricula, but also health professional curricula, which was one of the questions also in the chat, and also driving climate litigation. And all of this really to call policymakers and stakeholders to put the most affected people at the center of responses, both in terms of policy, financing, and interventions. Some examples very briefly of this is, for example, the proceedings at the International Court of Justice on the obligations of states in respect to climate change. This was led by a group of law students from the University of South Pacific, and from a student movement in Vanuatu, it became a global youth movement through the World's Youth for Climate Justice, really calling for the responsibility of nations in terms of safeguarding the rights of current and future generations against the harmful effects of climate change. But we've also seen young people filing lawsuits against governments in countries such as South Korea, Colombia, Pakistan, Canada, Australia, at the European Court of Human Rights, and also against fossil fuel companies. And many of the times the arguments are the violation of their right to health and the rights of children as key principles for these arguments. At the same time, we're also seeing that big fossil fuel corporations are doing everything they can to shut down this youth activism. And we're witnessing an increase of the use of SLAPs, which are the strategic lawsuits against public participations, which are used by big fossil fuel corporations to really silence and stop climate and environmental defenders. And this often causes both psychological and financial harms to young activists who have to engage in very costly legal battles to defend themselves. And as well, governments around the world, there's many examples of trying to stop climate youth activists from their work. And so many young people around the world are using all of their energy and all of their forces to really step up. They're skipping school days, university days to really fight for their future. But it's clear that we need the support and we need the help of all stakeholders, and we cannot and should not be acting alone. Stakeholders, this is really a plea for stakeholders to really support young people, children, adolescents, and young people in their activism, both in terms of support, in terms of financial resources, capacity strengthening, meaningful collaboration. And often it is said that really engaging children and adolescents gives us hope for a brighter future, and that we will solve climate change, but I think we really need to wake up to reality and to what the science is saying. We don't really need hope, but we need ambitious and real action now, because the science shows that even if we were to stop all greenhouse gas emissions today, the planet will still keep warming for millennials, and so we would still see the devastating impacts on human health and well-being. So what we really need now is really for all stakeholders to step up and work hand in hand together with amazing young activists around the world, and really advance for effective climate action that can address also the impacts on our health and protect the health of all humans, especially those most affected, of future generations, and also of our planet. Thank you, Rajat. Back to you.
Thank you. Thank you very much for that, Julia, and both for your anger, your frustration, but also for your passion for doing what you do, and the kind of initiatives that young people are indeed at the forefront of in terms of finding solutions, litigation, and other measures that we've talked about. Colleagues, we've had an intense 90 minutes of discussion together. As Bruce mentioned at the top of the conversation, we were almost over 300 when we started. We are roughly around those numbers still. This shows both your commitment, but your passion to this conversation as well. One of the things that came out repeatedly through our conversation today was the value of partnerships, of transnational, of multi-sectoral partnership, of cross-sectoral alliances for us to drive the kind of solutions that we want to achieve. The need to ensure participation of young people, of women, of children in designing solutions that are required to drive change at the real level. We talked about the challenges, we talked about research gaps, but we also talked about how knowledge and evidence is rapidly catching up. I think the question that we need to be leaving this conversation is, what will it take for us to drive change? It's happening. It is affecting all of us. It is affecting our families, our communities around the world. We do need to come together in unison to work on these issues, to drive change at an effective way at not just the global policy levels, but also at the national and local levels as well. Thank you so much for joining us for this conversation. We look forward to continuing this conversation with you in different forums and spaces, but also look forward to inviting you to the next issue of the Implementation Policy Dialogue Series, Ready, Set, Implement. Thank you for joining us. Have a good rest of the day where you are. Thank you.
Thank you. Bye-bye.
Thank you. Bye-bye.